Good evening, everyone, and thank you for joining us this evening for Not All Wounds Are Visible, a community conversation. Today, we will be talking about the topic of the day, which is unburdening racism, injustice, and inequity to create a path forward. I'm Donna Jacobs, Senior Vice President at the University of Maryland Medical System, and I will moderate this evening's event. This today is part of our series on mental health, Not All Wounds Are Visible. And as I said, we're discussing the nexus between racism, injustice, and inequity on mental health. This series is meant to be interactive, and we mean so especially today. We want to take your comments and your questions and offer thoughts for you to digest or for your consideration. We have 3 right now, and hopefully 4, I'll explain, experts with us who'll share their perspectives and answer your questions and comments on these issues as we go about the evening from a mental health perspective and hopefully as well from a spiritual standpoint if our last speaker is able to join us. Let me encourage you in that vein to use the question and answer box to write your questions or your comments as we go along. And we, again, have deliberately scheduled this session to get in as much dialogue as we can rather than to have a lecture format. And with that, let's begin to get started. I want to introduce our speakers to you, or our experts, I should say, to you. Dr. Anik Forrester is a board-certified psychiatrist, and she serves as the Chief of Diversity for the University of Maryland Department of Psychiatry. She's a graduate of Howard University College of Medicine, and she completed psychosomatic medicine fellowship at Thomas Jefferson University in Philadelphia. She has specific research interests in women's mental health and perinatal psychiatry and a penchant for teaching medical students and providing a resident education related to culture and bias. Dr. Kim Gordon is a child and adolescent psychiatrist with specialized expertise in community psychiatry and complex pediatric trauma. She's the program director at the University of Maryland Child and Adolescent Psychiatry Fellowship. She is a child psychiatry consultant to the University of Maryland's programs for assertive community treatment and the founder of Bringing Health Equity Training to Communities, which focuses on building blocks for health equity in BIPOC communities. She also provides training to medical students, residents, fellows, and allied health professionals on issues related to systems of care, juvenile justice, social determinants of health, cultural competency, and more. Dr. Crystal Hahn is currently a child and adolescent psychiatry fellow at the University of Maryland Medical Center and Sheppard Pratt, where she also completed her psychiatry residency. Her special academic interests include cultural psychiatry, the Asian American transitional aged youth population, and psychotherapy. She's the recipient of the American Psychiatric Association SAMHSA Minority Fellowship and a student at the University at Washington Baltimore Psychoanalytic Center for Psychoanalytic Studies program. Dr. Kevin Daniels had a couple of issues come up this evening, and I do hope that he is going to be able to join us. And with that in mind, let me just tell you about him, and hopefully he'll pop in as a presenter with us. He's a postdoctoral fellow at Harvard University Leadership Institute. He holds 2 doctoral degrees, one in higher education from Morgan State University and one in theology, and this is where we get our spiritual bent from, for this theology and public health from the United Theological Seminary, a master's degree in social work, and an undergraduate degree in social work from Morgan as well. He is also a holder of a certificate in advanced studies in addictions counseling from Johns Hopkins, and he's currently the chair of civic action with the Ministers Conference for the Baltimore region and a community strategist with BUILD. Many of you may know that term. So this is an awesome group of people with whom to have this conversation. And let me just say again, please do feel free, as we want to make this as interactive as possible, to put your questions and your comments in the Q&A box, and I will raise as many of those up as is possible during this session. I would like to start by asking each of our experts here just to make a few opening comments. And to do that, let me start with Dr. Forrester, who perhaps can set the stage for us and then share any other comments that you might like to add. Dr. Forrester.
Thank you so much, Donna. I want to thank everybody who's joining us today, and also thank the other panelists for being here. I want to just start off by sort of setting the stage for the kind of conversation that we're going to have today, which is a courageous conversation. And what that means is that we're going to be talking about race, bias, social injustices in a way that many people may feel is controversial, different topics, and maybe people have different points of view. But we really want to encourage that. This is not meant to promote one view over the other. It's meant for us to talk together rather than to retreat in our own separate corners. So we want to listen to understand, not to respond, and we want to make sure that we value everybody's thoughts, but we can also disagree respectfully. And again, when we're talking about controversial topics, it's important to understand that there's different points of view, and that's okay. The way that we move forward and we build is to come to some consensus, but also listen to each other and find out where we're all coming from. So I wanted to encourage everybody to do that and to speak from places of honesty and to understand that there's no judgment here. We're sort of trying to come together and understand each other's points of view.
And might I add, there are also times when people feel a little bit, I'll call it triggered sometimes by what one may say. And we encourage you to hang in there if that seems appropriate, if you want to take a break. And we're not suggesting that we're trying to be controversial or hurtful in any way. It just does sometimes occur. And we ask you to find yourself, safety, if you will. Anything else, Dr. Forrester, before we turn it over to Dr. Gordon?
No, I think let's hear what the other panelists have to say.
Dr. Gordon?
Thank you both for a wonderful introduction. I will say that, and to start a courageous conversation, you have to also own that it's possible that even the panelists today, the experts, are also engaging in a courageous event. This is a very personal journey for me as a professional African-American woman to be here to talk to this audience. So I hope that if you learn a little bit more about the experiences of the patients that I treat, or even some experiences that I may feel comfortable to share today, that you understand that this is a journey of really exploration of humanity and how we can live and interact with each other and work and play and worship and love in a way that feels safe for everyone without the constant threat of biases or intersections of oppression such as racism getting in the way. I also want to just say that, when we talk about the wounds or the traumas of, racism or the traumas of poverty, we live in an area, we work in areas where we see the manifestation of that for generations. So there's an intergenerational trauma that's happening in communities of Baltimore that really shouldn't be ignored, that we should, even if we are not personally experiencing that, as human beings, we have a responsibility in a way to help each other. And I think that comes with a little bit of privilege. I remember growing up in rural Louisiana and really understanding that poverty had a different feel depending on where you live, right? So the people I grew up with didn't have a lot of money, but there was a different feel than maybe what's happening in the inner city. There may be different ideas about violence in communities and who's responsible for the violence in communities, or a different feel about police brutality and who's responsible for and accountable for making transformative changes in the lives of individuals so they feel safe in their communities. But regardless of your perspective on that, the idea is to really be heard and to be seen. And so I hope that in me joining this talk today, that I'm given an opportunity to be heard and seen. And if you disagree, that you also understand that we could walk away disagreeing, but have an opportunity to learn a little bit more about the perspectives of others. One thing that I'm very passionate about as a child psychiatrist and someone who does health equity and consultant work is to understand that where we live, where we play, where we work, our zip code matters. We are in a time where we can understand that based on where you work and where you live and where you play, where you have your home, can dictate how long you live. So there's a weathering effect that's at stake. And the COVID pandemic showed us a lot about the disparities and inequities in healthcare related to where you work and live and play. So thank you for the opportunity to be a part of this talk. I look forward to hopefully a vivid conversation.
And thank you. And I apologize. I should have said Dr. Gordon Achebe. All right.
No problem.
Dr. Han.
Hi, thank you all so much for that warm introduction and all of the great tips and topics that have been brought up already. I have done a lot of work this past year in part leading discussion and support groups for AAPI or Asian American and Pacific Islander individuals in the UNB community. And as many of you are probably aware, there have been a significant increase in racist acts of violence against the AAPI community in this past year. And even here in Maryland, 4 Asian-owned restaurants in Columbia were vandalized a few months ago. 2 middle-aged elderly Asian women were attacked with a cinder block in downtown Baltimore earlier this month. And so particularly the racism and discrimination violence against AAPI individuals has had a hugely detrimental effect on these communities' mental health and well-being, both in this past year and even before. There's been a historical and long-standing history of this country, starting in the 1800s, of anti-Asian racism, which it would take the entire time for me to go into that. And as this past year shows, kind of the model minority myth can quickly transition back into kind of like the yellow peril narrative. And those are all things that in the AAPI community are big issues historically and ongoing. And so I really look forward to lending my voice today to kind of advocate for all of us to come together and have discussions about these issues and what everyone thinks. And as Dr. Gordon said, just really start having the conversation from everyone's perspective and just starting to have these kind of difficult talks, because that's always where the first step is. So thank you everyone for your introductions.
Well, thank you all for that. We did receive a couple of questions, or a few questions in advance, and maybe we can turn to some of those and begin to get your perspectives as people are thinking what they might want to pose to you. So I'll throw this out to all 3 of you for your comments, or anyone who might like to speak. Can you explain the relationship between racism, and I guess I can add an inequity, injustice, and health and well-being? Who would like to start?
I mean, I can start. I'll have just a brief take on this, because I think this is a layered question, and there's so many ways that racism and injustice affect people's health and well-being, starting from actually the time that you're born. Because the environment that you're born into, the care that your mother receives while she is pregnant, and also in the delivery, affects people's health and well-being. We know that Black mothers experience higher levels of adverse outcomes in childbirth, and that has a ripple effect for kids down the line. I'll let Dr. Gordon say a little bit more about that. But also, there is a continuous stress that's sort of placed upon people because of the environments that they live in, their access to health care, their access to healthy foods, open spaces to walk around, neighborhoods, and all of that is affected by racism and the way that structures have been created that affect people overall. So it's multi-layered. There's a lot of ways to attack this question, but that's just my take on it.
Dr. Gordon?
Yeah, I'm glad that Dr. Forrester said that you can take this question from multiple different angles. You can look at it from a historical lens and say that, the structures that we have created, the healthcare system that we created, may not have been designed to really understand the needs for different ethnic and minority groups, or may not have been designed to look at the needs for the difference between, let's say, an Asian or a Latino woman or Latinx woman versus an African American woman. And even though, we hope that we understand those things in medicine, oftentimes how we define wellness is based on our medical skills or our lens, and never necessarily thinking in a holistic way of what wellness means. Wellness for most people means a sense of a well-being is a sense of knowing that you can foster opportunities to be whatever you want. That's kind of like the ideal American dream, like whoever you want to be, you can be. But not only that you have the opportunity to access resources and services, financial resources, educational resources, health resources, spiritual resources, without feeling because of the color of your skin or because of your sex or because of your religion or sexuality, that's going to be impacted and someone is going to prevent you from access. So when I think about well-being, I think about the ability to access resources to manage your health, to manage your spirituality. And when I think about stress, which racism is a form of toxic stress, I think about the weathering effect that happens to a person over time because they're striving for well-being and striving for achieving their goals, but they may have hiccups along the way or just overt events along the way that prohibits them from actually really exploring and fulfillment of what health means, like being able to come home from work after a long day and not process a microaggression so much that you miss that opportunity to go work out with your friends and go dancing or just live a full life. So it's a loaded question, but it's an important question. What does well-being mean, I guess, to the audience? And I think that differs depending on the person and where they are in their life.
And if I could add to that, there's been a very well documented relationship between racism and discrimination and adverse mental health symptoms. I read a study recently on 405 or something, young adults of color, and controlling for all other kind of like SES and like identities that they hold, racial microaggressions actually predicted suicidal ideation that was mediated through depressive symptoms, including depressed mood, changes in their sleep and appetite and their concentration. And as Dr. Forrester had mentioned, and Dr. Gordon as well, kind of like the structural factors related to racism on top of that has very kind of logistical, structural, systemic impacts on both mental health and physical health. And in this study, they even have found a correlation with racial discrimination and medical sequelae like heart disease and diabetes. And so it's all very much interrelated and layered on complex, and showing that kind of like racism and racial discrimination really has an impact on so many aspects of individual people's lives and societal levels as well.
Yes, thank you for that. So before we go on to one of the other questions that came in advance, there's a question that came in that said, can you list, and you guys have started to mention some, how do the effects of inequity, inequality, injustice, racism show up? How do they manifest? I've heard stress, I've heard depression, I've heard a relationship with other chronic diseases. Can you talk a little bit more about that?
So one thing that we understand is that the environment that you're in plays a huge role in your stress level and your physical health. So given the fact that your health is sort of so interrelated with your environment, what happens is that when people are exposed to chronic high stress levels, either by seeing violence, being exposed to different traumas in the family, or just being out there and then not having adequate access to care, it can come out in different ways. So on the mental health side, you could have people who develop depression, anxiety, post-traumatic stress disorder, and that's a lot of times those are the That's how we encounter folks. But then on the other side of that, if you have a severe depression or severe anxiety, that acts as a barrier if you're not in treatment to taking care of your physical health. So that leads to untreated issues with diabetes, as Dr. Hahn was mentioning, hypertension, that's missing appointments with doctors for your routine care, so maybe missing out on preventative things so that you won't develop more significant disease down the line. So there's so many ways that this plays out. And so people's mental health is so significant to sort of mitigate what happens to your physical health, because you really have to be in a mentally healthy place to take care of yourself physically.
Thank you. Very helpful. And let me welcome Dr. Daniels, who has just joined us. Thank you. I gave an intro at the beginning, and we hope that you are going to be able to come in. So we've just started our conversation, and after introductions, we talked about courageous conversations, what they mean, and how we can all participate without judgment here, and feel free to say what it is we'd like. And we've just spoken about one of the first questions that's come in advance, and then a follow-up question that we just had. If we can turn maybe to the next question, we can keep this going. So it's that one again. How do the effects of inequity and racism show up? Dr. Daniel, if you might like to comment. We've heard.
I do. I was listening to the last comment, and one of the things that I'm real clear about, I served on a part of the Maryland State Social Determinants of Health, and in every one of those 6 categories, whether or not that meant education, whether that is poverty, and/or food, the environment, support systems, we found that even in Baltimore, Maryland, we found a huge gap as it relates to some of the kind of things that just those social determinants of health can cause, not only just on crime, but also all other kind of challenges as well. And that is across the spectrum and across the board. So I think that even as we start to look at several of the inequities and all of that, we determined on last year that, of course, as a study and as a board, we still determined that they have huge impacts as it relates to access, but as it relates to health as well.
That's great. Any other comments on this? And we can go to that third question. All right, let's look at the third question that came in advance. Earlier, I think it was Dr. Gordon who mentioned the term microaggressions. So maybe we can explain that first, but this question is about that. What are some examples of microaggressions that negatively impact our mental health, and how can we deal with them?
I can start with that. So my understanding of microaggressions is that they're kind of like the everyday verbal or even nonverbal slights or insults, whether they're intentional or not, that communicate kind of like negative messages and targets people based on like their marginalized group membership, be it race or ethnicity or gender or sexual identity or religion or class. And some of these can be kind of innocuous and may not be intended to harm, but it usually contains like a hidden message that is harmful, especially as it is accumulative. And so I think that examples of microaggressions differ depending on kind of the identified group that you're talking about. For example, a common microaggression that AAPI individuals experience is being asked, "Where are you from?" And then for me, I was born and raised in Wisconsin. And when I say Wisconsin, they'd be like, where are you really from? Like, you know what I mean? So even if it was kind of innocuous, it serves to kind of make you feel like an other or like you're a foreigner and that you never belong. Whereas a lot of kind of Black individuals have experienced kind of like being watched in stores or having like passing someone and having someone clutch their like purse closer to them or something like that. So that's kind of where my mind goes.
Well, before others comment, let me say this, and maybe our listeners might want to share whether or not they've experienced in the Q&A box, whether they've experienced a microaggression or maybe after hearing that example, even unwittingly have committed one. Go ahead, Dr. Daniels.
Also looking at micro assaults, the three types of microaggressions, looking at micro assaults. Again, and I think she said that, you know, behavioral, verbal remarks or comments that convey rudeness and sensitivity, micro insults, communications that convey, of course, rudeness and insensitivity that to demean a person's race and or identity, micro invalidations, of course, of communications that exclude, negate, and nullify the psychological thoughts and feelings of the reality of a person of color. All of them have impact, and to the point where, and at times, persons may not be aware of the fact that they are causing those levels of assaults.
So I'm going to share a personal experience because we're asking the audience to do courageous conversations. And so I think that we have to be courageous. So just yesterday, I was supervising a fellow, and the patient's mother said to me that my hair is like a person's donkey's hair. Like she has a donkey and my hair looks like a donkey's hair. And, you know, it was just a random, you know, overt comment that didn't necessarily trigger me at the time, but as I thought more and more about it, over time, it became more triggering just to think about it. You may have heard of the Crowns Act. It's an act that put into legislation that employers and places where you work can discriminate against Black women based on how they choose to wear their hair. So that's one of those things that is a microaggression that has impacted people's ability actually really to feel comfortable in the workplace. So for example, I talk to many African-American women who say that they may miss a day of work because they are afraid to show their natural hair, or their hair is not presented in a way. But that's missing a day of work is actually missing resources and money and financial things. And so when we talk about microaggressions, we oftentimes think that they're just like minor, but over time, as they accumulate, they become a little bit more than just a typical invalidating event. It becomes something that actually changes the way you live your life. So I just want to just say that although that was hurtful for me, I recognized it very early that it was a microaggression, and I was able to move on. But think about the individual who may not recognize it as a microaggression and begin to analyze and really look at that and say, oh gosh, you know, what does that mean? You know, and so we really have to do a better job of educating people on, especially as mental health professionals, on microaggressions that play out with our colleagues, but also microaggressions that play out with our interactions with patients. So when you come into a health center, or you come into a clinic, or someone is visiting you for your healthcare needs, they're not feeling like that's not a safe place to be their authentic self because someone made microaggress against them.
And that was, if I might, that was extremely powerful in the sense that this is courageous space. And I say this everywhere I go. I'll never forget getting my second PhD pulled over by a car, and I don't think this was a macroaggression in some sense, but the kind of stain that it left mentally upon me when I was pulled over by police officers in my car. I had a nice little car, pulled over. I'll never forget the street. I'm not going to name it, but I was pulled over, and the police officer, of course, threw me up against the car. Totally disrespectful. But then here came the comment, he looks like the one that pulled the gun on someone, and then left me up against the car as the woman police officer came and said, no, it looks like him, but he's not the one. But it just was disrespectful to the point where now I enjoy what she said because I internalized it. I'm the first in my family to get a PhD, African-American male. I internalized it in the sense of injected oppression, in the sense of I lived with it for a moment, but then eventually turned it over into something very powerful that led me of course, into the work that I do in with the communities, with the We Are Us men's movement in communities as well.
Let me jump in here. And I want to hear more from all of you. And thank you for sharing those personal experiences. I do think that did prompt a couple of comments about microaggressions. And the first one that came in says, the assumption that because I am a Black woman, that I am lacking in education, manners, communication skills, etiquette, and that there are sideways comments and questions that are made as a result of that. I'm asked casually how many children I have and where is my children's dad. In fact, I am educated and childless with a middle-class upbringing. When this happens with superiors and colleagues, this is hard to manage. And then one that followed shortly after says, how do these panelists advise that people deal with these micro or macro aggressions while we're talking about this, and that we learn skills not to internalize and to protect our well-being? Dr. Gordon, you said because of what you do, you chalked it up as a microaggression after it penetrated on some level. But not everyone, is a psychiatrist and knows how to compartmentalize it that way. So what's the advice?
Well, I'll tell that person, I'm still trying to figure out my comeback when microaggressions occur. I'm usually a person that's more thoughtful. I think about what I want to say before I say it. And so I wish I would be able to, when someone does that, quickly say, why did you ask that question? Help me understand what you were thinking when you made the comment about my hair, or when you made the comment about my intellect, or that I speak so eloquently for a Black person, or I'm more beautiful than whatever. So I think it's important for us to get used to questioning people, and that's something as a culture that we haven't had enough support to do, to let our voices be heard. But there's also the conversation that needs to be had about people who are in the room, who witnessed it, who can be an ally to an individual who may be microaggressed against. I think that is actually a more important conversation to have than the individual who has actually experienced that trauma. Because, as PTSD works or trauma works, it makes you slow to react. It's a cognitively slowing event that happens to you. So, I put the onus on all of us to really understand that we play our part to address microaggressions. I do think it's also important to know and name it, right? So if you see it, name it. And say, hey, I'm not trying to say that it was intentional or whatever, but when you said that to me, it made me feel a certain way. And this is why it made me feel a certain way. And I think, in our society, it's hard to have those type of conversations. You may be in a board meeting or you may be with a group of people, but make a note of it, talk to a friend, and then come back to that person and say, hey, on this day, this happened. And I think it's better to bring a colleague who may be an ally or someone who also witnessed that, and just to get that added support. If we do more of that in the workplace and also in the healthcare setting, I think a lot of people will feel much better.
I think that's all very excellent advice. What did you mean when you said, because sometimes people may be asking out of curiosity or trying to be inclusive and not understanding that it has a different impact, and then bringing an ally. And there's a comment here from someone who says, and I think those your answers were instructive here. It says, I'm Hispanic and biracial, and much of the time people think it's okay to ask, what are you? With an emphasis on are, or assume I was not born in America, and then went on to say, how do I deal with that? So you've given us great advice, but isn't it tiresome? Doesn't it become tiresome? Because microaggressions don't just happen once, right? What do you do about that for your own mental wellness?
So I think that part of what conversations like this do is help you to build community. Because I think that if people feel alone and misunderstood, or feel like these things are just happening to us, then it becomes way more stressful than it needs to be. But by talking about it, by finding those safe spaces to have those conversations and reflect with someone, even if you're not going to see that person again who asked you that question, but you have a safe space that you can go to talk about it, it helps to relieve that stress, which sort of brings us back to how it affects our mental health. Because one of the things about mental health care in general is that it's highly stigmatized not only in our society, but also in communities of color. So that if you are struggling with your mental health, it's harder to talk about it. And you might be actually more likely to experience a microaggression because you're talking about it. Oh, you're not depressed. Just get over it. Just get up. Go out, take a walk, and not really understanding what that person is trying to express or what they may be going through. So it's multifaceted in terms of how not having safe spaces to talk about what's going on with you or having people that can support you will affect you, but very specifically in terms of mental health, because we really just we're not supportive of mental health in general in our society, and again, in specifically in communities of color.
So there's a question, Dr. Daniels, 1 second, because there's a question relevant to the issue of stigma. It says, I'm very interested in your take on the confluence of racism as stigma, as barriers to identifying a mental health crisis point, and how this impacts identifying, diagnosing, and treating with humanity. I am especially interested in crisis situations such as Korean Games, Baltimore, and situations such as our youth and adults coping in educational settings or work when having a mental health crisis and not being criminalized, but properly identified. Long question. Thank you for your answer.
Yeah, I mean, I just wanted to add about the microaggressions point. We will have a list of resources at the end that includes specific, really valuable work that includes some templates on different ways to respond to microaggressions, as well as kind of algorithms to go through when you experience it, for example, in the workplace, and with different situations. So just to let you all know, there are a lot of resources out there, including Hollaback, Bystander intervention that gives specific free workshops on how you can be an ally or respond in different situations as a bystander versus a victim, and stuff like that. And so I also can respond briefly to the question you just asked, which I think is a super great question, because racism, as there's already a layer of kind of like mental health stigma in our society already, and racism and race really serves to kind of complicate that. And as we know, there's also been a very long history of anti-Black racism in terms of mental health crises and targeting other people of color too in terms of mental health, as well as other systems, including the educational system and the criminal justice system that you all mentioned. And especially as people who work in Baltimore City, I see every day examples of kind of misdiagnoses. A lot of people of color are misdiagnosed with psychotic disorders such as schizophrenia, when in actuality, they might be experiencing something more along the lines of depression and anxiety, or maybe arguably a normal, appropriate behavior reaction to the stress that they are experiencing in their lives, but through kind of implicit bias and internalized racism, providers do make the mistake of misdiagnosing and thus mistreating certain mental health disorders based on skin color, which is very unfortunate and not okay. And I think that the complicating factor is a lot of this is unconscious and internalized and not in our awareness, which is why discussions like this is so important, because that's really the first step of examining in yourself, like, where do I have these blind spots? And I would argue that it manifests differently among different communities of color. For example, a lot of kids I see in the child clinic are Black kids in Baltimore City schools, and the school to prison pipeline or school to mental health pipeline is very much based on kind of like racist misconceptualizations of their behavior and ignoring a lot of psychosocial and race-related factors that they're experiencing. And kind of on the flip side, in the Bay Area, I know that a lot of Asian students actually rate their own sense of like depression and anxiety as higher than some of their Black counterparts, due to kind of the model minority stereotype of thinking every Asian kid's good at math, they're all academically high achieving. So when they do suffer, they're keeping it all to themselves because they're being told, I'm not supposed to have these issues. I need to all keep it to myself. I'm just weak. I need to kind of pull through it. And so the way racism kind of manifests it can be very different, but very detrimental to multiple different groups.
Thank you for that. Dr. Daniels, I think you had a comment a few minutes ago you wanted to make.
No, I think that, I think that even to the question of stigma and male, even working with males, I think that it continues to be, I'm working with a group of males even now as it relates to Healing Us Together. It's a group that we put together to deal with trauma, and particularly even in Black males, this whole notion of stigma, it becomes critical because we're looking at it not just from a safe space, but from a brave space, and being able to have the conversation about not just microaggressions, but also some of the levels of depression, some of the levels of anxiety that are being navigated, and the not the fear, but the stigma of even going to get and to navigate any kind of therapeutic intervention. It continues to this particular moment because there is a fear of misdiagnosis, and particularly based upon some kind of racial rubric, that something is wrong with me versus something is right with me, which is the healing-centered modality of looking at mental health. I promote that in the sense of what's right with me, being able to start there and instead of trying to end up there. So I think a lot needs to be reviewed, reflected upon as it relates to how to navigate people of color surrounding diagnoses, assessments, and even interventions within the larger framework itself.
Very good. We jumped right in with the first question on the connection between mental health, racism, inequity, and inequality without defining the various forms of racism that exist. And one of you just a moment ago, I think it was you, Dr. Hahn, mentioned internalized racism. There's a question here about that. And we did at the very beginning say all viewpoints were welcome. So here's one of those questions. As an Asian person and first-generation immigrant, I'm well aware of the fact that about 90% of violent hate crimes against Asians are committed by Blacks. I'm not sure if that's the right number or not. But the second part here is, please enlighten me why this is the case and how internalized racism has exhibited itself in Blacks.
Can I answer that question instead? I'm sorry.
I was just throwing it open to anyone.
I want Crystal to answer the question, but I also think because it's a question about two identified minority groups who are marginalized and experience racism for different reasons, and how that intersects in the everyday, today, interactions with each other. If you think about the migrational history of African Americans in this country, from slavery to those who come from Caribbean ancestry or even from Africa, many people don't understand that African Americans as a group are not homogenous. They are heterogeneous and their experiences are very diverse, right? And so what I see happening in, let's say, communities of color, when there's intersection of a thick and dense poverty, and you see the confluence of certain minoritized groups maybe appearing to have more resources or access, how that in itself leads to conflict. There was a great movie some years ago, I think it was, just kind of showed what was happening in LA as it relates to racism and the thoughts that was going on in individuals around that internalization of how racism impacted the way that they interacted with each other, where you may see an Asian community who have a shop in an predominantly African-American community, and the perception that that Asian person had more access or more resources than we had. And so I think it's a complex question because really this conversation needs to be had with people who are in a power position who have the influence to really change the way communities of color can interact with each other, where there's not a competition, right? It's because the reality, this country was built to have Irish Americans, Italian Americans, African Americans, anyone who came from a more marginalized group believe that the fight is against each other and not against power structures. And so I think that's the way I think about it. And I think it is an important thing that we are seeing. That it's also true that the media tends to shed light on violence that's perpetrated by African Americans more so than they do than other communities. And so we don't know if the information that we're receiving is accurate. We do know that it's harmful to the Asian community to feel like I'm embedded in your community and you know me and you see me every day and you're violent against me. So we don't want to perpetuate that myth because we understand that media plays a part of that. So that's my opinion. If my opinion differs from Crystal, Dr. Hunt, I support that, but I just had to jump in there.
No, I appreciate everything you said, and I really agree with it. I think that it's so complicated, like it's so layered. And when we talk about racism, like Donna mentioned, there are layers and levels of racism. Like there's structural racism that lies within institutions, systems, and structures determining access, education, healthcare, and all of that kind of broad stuff. There's interpersonal racism, like a direct attack against an Asian person by another person due to anti-Asian racism, and there is individual internalized racism within ourselves, like all of us, right? And so, with all of our each individual and ethnic histories and the complex dynamics throughout history and in modern times, it's just a really difficult question. And I appreciate you asking it because I know tons of Asian people thinking the exact same thing. Like, this is not like a new idea. It's a very uncomfortable idea, but I appreciate it being brought up because this is like a courageous conversation. And so I don't know, first of all, about the statistic. I don't know that 90% of these attacks are perpetrated by Black individuals. I do know that, I keep harping on this, but like the model minority myth is like this insidious, subtle, kind of like poisonous rhetoric that infiltrates so many layers of not just the Asian American experience, but how we as Asians are seen in the society. And as Dr. Gordon said, it serves to paint Asians as successful, economically accomplished, but also quiet. We won't rock the boat. We're politically like invisible. We don't speak up. So I think both of those parts of the model minority myth serves for not just Black communities, but all of America to see Asians as potentially an easy target for resentment, especially with COVID and the whole kind of Trump narrative of the Kung flu and the Chinese flu. I think it made Asian people this year in particular an even more easy target to displace XYZ, like resentment, rage, hate, and that was very much heightened because an actual target was put on our backs, and the myth serves to be like, these Asian people, they're doing so well and they're not going to fight back. So let's, whatever. And the yellow peril narrative of Asian people are a threat. They are an existential threat for jobs, as was thought of in the 1800s when they came and like did coal mining and the transcontinental railroad. And it, like, that narrative has come back and has served to put a target on our backs as well. And so I do know of anecdotal and media coverage that some of the attacks were perpetrated by Black individuals. And I know in the Asian community, there's also anti-Black racism. Like, it goes both ways. And I think that the kind of idea that Dr. Gordon referenced is, in my mind, kind of like the term of the oppression Olympics of who's got it worse, whose fault is it that I'm in this really like terrible position? And you know, it's valid to feel rage, and it's valid to want to need to feel like you have somewhere to put it. And in the context of American society that we live in, which is in white dominant like structures that we all live in, we're reenacting the past of having different marginalized groups pitted against each other, fighting for crumbs, blaming each other, but missing kind of like the big picture of all of us trying to survive under white dominant structures. And so I think I hope it was a coherent answer to a really difficult question. And I want to say that Black and Asian solidarity has always existed and still exists. The media is not amplifying that. After the LA riots and Rodney King, a lot of Black communities like attacked Korean American communities, and it was awful and it was terrible. But what wasn't reported was the rebuilding of that afterwards. Like leaders from both communities came together and put in a lot of work to rebuild each individual community and rebuild those relationships. In the past year, there have been Asian people showing up for BLM protests and Black people showing up for Asian solidarity protests and Stop Asian Hate protests. And we don't see those stories. And there's a lot of reasons as to why, but it exists. And so I don't know, that's kind of my stream of thought here.
Well, clearly, and it's a great stream of thought from both of you. And one of the things that seems to me perpetuates racism, I'll call it, or perception of that, it may not be the actual facts and may not be the actual data, but it's the perception of what the facts may be, right? And that keeps certain groups divided and fighting amongst themselves. Dr. Daniels, I see you anxious to jump in.
Well, really quick, sometimes for me, it's a deflection for some of, I'm not insensitive to that, but sometimes it is a deflection off of some of the real structural, systemic, and institutional kind of issues. We've named it in the state of Maryland. Adrian Jones named it. Joe Biden named it in his inauguration speech. And sometimes I'm not being insensitive to that because of course it happens, but it is sometimes it can be used as a deflection to not deal with some of the structural and systemic issues that are continuing even to this particular point. It's like saying, and I have to deal with it all the time at the university, Black on Black crime. Again, we know that that's going on, but also the percentages are the same for white on white. They are the same, but deeper than that, the issue we know at the poverty level, we know the percentages of people that commit crime are below the poverty level. So structurally, why not deal with poverty in this particular country? So again, I get, of course, as sensitive as I am to issues like that, I also sometimes see it as a diversion and a deflection.
Let me acknowledge this. So this is the second webinar that UMS has done today, and I'm seeing some names that I saw earlier today. And there's a comment here from one person which says, "This is more a statement than a question. It seems that the goal of oppression is to pit minority groups against minority groups. Because if we actually looked below the surface, we have more in common than differences. And if we were ever united, we would be unstoppable." And you got thumbs up and good prayer for that. I think that's a perfect comment. Anything else?
I just want to say that we've been talking about the structures and the systems that perpetuate racism and oppression. And I think that part of what everybody here is trying to highlight is that idea that essentially what we do need to dismantle is the structures. And because there's resistance to that, and there's also a fear of what does that mean? Because if America was built on sort of a white supremacist notion that certain people are supposed to be at the top. We're a capitalist country, so then you're white, you're at the top, and you have money. Then what happens if you are not that? And so part of how structures are constructed is to support that idea. And anything that flies in the face of that, we get skewed perspectives on. But that's really the issue, because for so many of us, we don't fit that. And there are poor white people who don't fit that narrative, who then are affected. So that's to Dr. Daniels' point about poverty. But in order to sort of keep us away from that, it's easier to continue to perpetuate racist stereotypes, pit people against each other. Remember, children are not born racist. Racism is taught. Racism is perpetuated generation after generation. And part of what we have to do is look at that and understand why that is. That is to uplift and support the structures that are in place that really this country was founded on.
I want to return to the microaggression just for a moment, because there's a question here that resonates with my younger self, not my older self. But also, what do you do when it's a supervisor or someone older or higher up who has named that microaggression? Because I find it very difficult to respond with the responses that I prepared in my head. How do you break through and name it, say it, question it? What advice do you have for my younger self? Not me, I got it now, but for our questioner. Is there an answer?
Yeah, I think for me that there is an acknowledgement, of course, the naming of it, but then there is an opportunity as well for some narrative and storytelling as it relates to some of the and education about some of the microaggressions, and hopefully from their intervention on what moving forward looks like after having not just named it, but also an opportunity for storytelling. As I work with the men's group, I get a wonderful opportunity to hear stories, and it begins to shape, educate your understanding of where people have been, even people of color. We don't all share the same story. We're not, of course, monolithic. So it creates an opportunity to be able to share stories. I'm a part of an community organizing group. We share, before we do actions, we share stories. And a lot of times we're not hearing each other's stories, or we're not taking that kind of space nor time to begin to do that. I think it creates an opportunity for that.
Does trauma factor in here? Are the microaggressions received to a body as trauma, or what we might see in the media? We talk about the negative images and the hyper focus on one minority group over another. Is that trauma? Do we describe it as such? And if such, a lot of child experts here, child and adolescent here, experts here, what's the impact on children and adolescents versus adults? Are there differences in how it's received and how it impacts someone's mental well-being?
Well, I'm very interested to see what's going to happen to the youth who are not in school because of COVID, but who also experience the social process that happened across this country as it relates to racism. I don't think that we have had an opportunity like this in a while to really kind of examine the consequences of these kind of inequities in our communities over time. And so I'm hoping that not in a way that is toxic, but a way that we can kind of research the impact of grief and loss from youth who've experienced family members who died because of COVID, particularly in the African American and Latinx community over time. And then also see what those experiences would like to see this, racism play out on the big screen. But I think to answer your question, we know that any type of stress, whether it's sexual abuse, child abuse, racism, or parents separating, or having to move to another school over time, can lead to a cumulative type of effect. But we classify racism as a social determinants of mental health. It doesn't necessarily mean that it's traumatic to every person that experienced racism, because depending on your support systems, depending on what you have in your environment to buffer you, to protect you, to tell you that you're valuable, that you're loved, that, you know, that we will address issues that come up as parents, can make a big difference in terms of how kids experience adverse experiences, right? Not every toxic or stressful experience has long-term effects. But we do need to recognize when it actually does. And we understand that anytime a child is exposed to excessive poverty or excessive violence or excessive traumas of sexual or physical abuse, that can lead to, PTSD, but also leads to other mental health conditions. So I think to answer the question, we really want to say that adverse childhood experiences exist, even in, predominantly white families where there is very little poverty because of their SES is higher. Their children also may experience an adverse childhood experience, but it doesn't necessarily mean that they're going to go on to develop a disorder or have problems in their life. Children are very resilient in that way, particularly if adults and communities support them.
And I was going to ask you just about that. So this last year has been traumatic for everyone. We've not seen this in a century, COVID, that is, and the impact certainly as part of that on certain minority communities. Is it incumbent upon us to do something to intervene, to intercept what we have seen happen with adverse childhood experiences with children and the longitudinal impact that they may have? Knowing that this has been so dramatic, is there something that it's incumbent upon us as adults to do with our youth? And what would that be?
I guess I can answer again. I'm from New Orleans, so I experienced Hurricane Katrina, and that was just a devastating time for the community. And we quickly responded with grief and trauma treatment and grief and trauma counseling and related services in the schools for children, because we recognized that it was not something that they could just go back to school and go back to normal, but kids needed to process and think about that. Teachers needed to process, and school officials needed to process that. And I think in the same way that New Orleans had to figure that out, it's our job as people who work with children to also have those conversations about the impact of COVID, and also the racial social protests that happen in a way that's thoughtful and trauma informed.
What do we do? This is a lot, and this conversation is certainly enlightening, and it's something, all of these are issues that so many of us and those on the line listening are experiencing repeatedly. We started with COVID last spring, and we went through a summer of protests, and we saw 9 minutes and 23 seconds of a murder on the screen, and it was replayed over and over, certainly, every night on the news for a while. And then we talk about microaggressions, and some people have said it's in my workplace, and I have a hard time dealing with it. So what do we do to keep ourselves well? What are the tools? What do we do?
So there's a lot now about, number one, sort of like checking in with yourself, taking care of yourself, understanding what your experiences are, naming them, and really seeking out those places where you can get help. So if it's mental health treatment, if it's community supports, if it's engaging in work that you find to be meaningful, if it's also just finding the community of people that are like-minded that you can sort of fellowship with and feel support from, those are places to start. And I think it's really, really critical as we're coming sort of towards the tail end of the COVID crisis to really think about what systems or structures do we need to put in place to protect those people who were most affected by COVID, who were disproportionately facing infection, like our frontline workers, our restaurant workers, that kind of thing. So to kind of jump in there and try to create part of that safety net, to be a part of it. Because that's one way to kind of engage and feel like you're useful, that you're part of the solution.
And that is a real good point, because That's when we started, several of us, a group from the Community Ministers Conference, also Johns Hopkins. We started the Behavioral Health Systems of Baltimore. We started the Healing Us Together community conversations, where just everyday people, regular people, can communicate and have conversations about safety issues, safety plans, as it relates to mental, emotional, spiritual. We're having those conversations over the last several months, virtual, but also emotional regulation, loss, and also being able to, after that, being able to point towards the future and begin to define it, reimagine it. Those are the kind of things that we're doing on a community level, at a street level, a grassroots level. We are inviting, we're continuing to invite not only organizational leaders, but just regular people that we can talk with and coach on how to get through, develop safety plans, emotionally, mentally, how to develop those plans, but first be able to have a conversation about it and be able to name emotional challenges, emotional regulation. So I think that several groups are doing some phenomenal things. I'm working with the Trauma Task Force of Baltimore City on that group, being able to even look at on the departmental level about policies and practice that deregulate people, so to speak. So I think some real powerful things are happening.
That's great. And we're going to wrap up here in just a moment. And there's a question about the resources that Dr. Hans mentioned, and we're going to share that. Maybe, Dr. Daniels, we can tell people how they can tap into some of those things that you mentioned in the future on our website. So I want to make sure that everyone is aware that you will be able to see this entire presentation in about 48 hours on the website, and I'll give you that in just a moment. If we can go to the resources, maybe we can roll through some of these. These are general resources related to COVID and mental health in a general way. There's always the Maryland 211, which someone can go to. NAMI, we call it, which is the National Alliance on Mental Illness. The Maryland Department of Health obviously also has a great deal of information about COVID, as does the CDC, if you wanted to get on their website. And the Maryland Children's Alliance. Next slide. Some specific tools on self-care for people of color. Racial stress and self-care, a parent tool. And we've spoken in prior sessions about how parents help their children through these things. The 4 Bodies, a holistic toolkit for coping with racial trauma. Healing in the face of cultural trauma, another racial toolkit. And then BEAM. And then I think there are a few for Crystal to speak. Oh, general. We always talk about the Maryland Network Against Domestic Violence. Again, these are general. I mentioned the CDC. SAMHSA has information. And the Suicide Prevention Hotline, the Lifeline. I am sorry to say that my observations are that during this year of COVID, with school being out and instability for children, their lives turned upside down, the number of threats and attempted suicides for children has risen. So we want to certainly be mindful of that. Dr. Gordon also put in that the Maryland Mental Health Alliance also has resources. Crystal, you go.
The Black Mental Health Alliance. Black
Mental Health Alliance. And then we can put those all up on our site at the end that I give you. And then Crystal, if you'll speak to these.
Sure. So I had mentioned that there's a responding to microaggressions document. This one was catered to medical students, but especially as the question of what do I do if this was a supervisor that perpetrated the microaggression, I think that some of the themes can still be useful to apply to other situations. There are some Asian AAPI specific resources, including Asian American Advancing Justice, Stop AAPI Hate, compilation on how to support Asian Americans in terms of racism and general emotional wellness. And I did put in, maybe it was the wrong chat, but there are resources from ACAP, which is the American Academy for Child and Adolescent Psychiatrists, on guides on how to talk to your children about racism. And Dr. Susan Song also wrote a great article specifically how to talk to your kids about anti-Asian racism. So those resources are out there too.
I want to thank, oh, go ahead, one more.
Sorry, and these are the bystander intervention trainings I mentioned earlier.
I want to thank each of you for your wise words this evening. It was very useful, and you can tell by the comments and the questions that came in that people were receiving them especially well. For all of our listeners, let me just say that this recording will be online, as I said, in about 48 hours at ums.org/notallwounds. Last year, we had a series on race and mental health, race, mental health, and COVID. Those are there as well for your viewing, should you like to see them. The sessions are all different and all very interesting and very intriguing, and resources shared at the conclusion of all of those. So let me just thank you all for your participation once again, and encourage people to, stay well, be well, learn to name things, and move right through. We're all going to get through this together. And I just want to wish everyone a great evening. Thank you so much for joining us.